Hi, everyone. Welcome to Brown. My name's Mark.
Hey, I'm Shreya. Hi, I'm Gaby, and we are third year pulmonary and critical care fellows. And we're going to tell you a little bit about our program. Our program director is James Simmons, and our associate program directors are Jisoo Lee and Rachel Darling.
So we'll go over the hospitals and then just do a brief discussion of the rotations that we go through, our conferences, the educational things, then also talk a little bit about Providence.
All right, so we rotate through three hospitals, but the one that we're going to be talking about right now is Rhode Island Hospital. I'd say we spend about 60 to 70% of our time here. It's a tertiary care center. We are a level one trauma and a burn center. We're also a pulmonary hypertension center. Over and above the medical ICU, which has medical ICU and a step down unit called the respiratory ICU. We also have the neuro ICU, the CTEC or the cardiothoracic ICU, the CCU, the trauma ICU, and the surgical ICU. And then the rotations that you guys would be doing here would be inpatient pulmonary consults. It is one of our outpatient clinic sites, and then the medical ICU, and also something called supervisory ICU and super pulm consults. And then we have the Miriam Hospital, which is sort of a smaller community hospital, also within Providence. It's about a 250 bed tertiary care center, level 2 trauma center. And it carries the Beacon Award for their ICU. There, we also do inpatient pulmonary consults and the mixed medical surgical ICU.
And then the third site is the VA. It's kind of a small to medium-sized VA. When you're there, you do both the ICU and Palm consults at the same time. Here, there's a bigger emphasis on reading PFTs, CPET as well, and the sleep studies. And you can really jump into the physiology behind Palm. And then also we have our longitudinal nodule clinic there, and you get to see kind of the workup of lung cancer.
All right, so for Rhode Island Hospital, where you do MICU, it's an 18-bed ICU. There are two teams, the west side and the south side. This is a pretty high acuity center. We also are a referral center for a lot of smaller hospitals in the area. And there is a night float system for Rhode Island Hospital, so nobody is on call at home, or it's not a 24-hour call that you would do for Rhode Island. We're also an ECMO Center of Excellence, both for VV and VECMO, for pulmonary and cardiopulmonary support. We collaborate with our cardiothoracic surgeon colleagues for cannulation, and we do between 15 and 20 runs a year.
And then we have what is called the RICU. This is kind of our step down. It is a 10 to 18 bed floor. This is where our pulmonary hypertension patients go, especially those who are on parentals. And then we have our chronic vent patients there. You can work on trach management as well too, and more step down level of care.
The Miriam ICU is a 16-bed mixed ICU, which is nice. You get to take care of cardiology, neurology, surgical, medical patients all together in that ICU. It also is the only ICU in the hospital, so you kind of see a lot of critically ill patients, like the neurocritical care patients, the surgical ICU patients. They all come to the ICU at the Miriam.
And so breakdown of how the schedule is, as a first year, it's primarily focused on the pulmonology services. And so you'll be at Rhode Island Hospital, Miriam Hospital, as well as you'll do 2 months at the VA plus another month there. While at Rhode Island Hospital, you're doing pulmonary consults. You will do some ICU orientation as well too, and then do 2 weeks of ICU night also. And then you'll get some time on research to get your program kind of or your research idea started and moving and trying to get IRB going. While at the Miriam, you do 2 months there on the pulmonary consults. And then we also have 2 months of outpatient. This you'll be rotating through different clinics. Pulmonary hypertension is a big one that we do. We also have ILD, we have cystic fibrosis. We have hypoventilation, and then also TB is another one too. This is just what a sample schedule would look like. And I think it's it's an alphabet soup, but I think things to focus on for the first years is when you do Rhode Island consults,
acknowledge and recognize that it can be really stressful to do a consult in a hospital that you haven't been at. So now we have kind of paired it with a rotation called Super Pulm, where a third year fellow will always be with a first year fellow. I think it takes the edge off a lot of the logistics things, having somebody supervise you. I think that's very helpful. But when you look at a sample first year schedule, you spent a decent amount of time at the VA. So these are 2-week blocks. So you do 4 months of VA at the start. There are some Rhode Island consults with some outpatient months kind of peppered in. You do some time at Miriam consults, Rhode Island consults, and outpatient again. You also have to have some time for research in your first year. And then quite towards the end, you will do something called orientation to the Rhode Island MICU, which is also new because initially we started on nights, but now you do have 2 weeks of days to kind of orient yourself to what MICU at Rhode Island is before you go to night float. This is what your sample schedule would look like.
Thanks, Shreya. I've kind of summarized this pretty well, but in the second year, it's different than first year. So first year, you're doing all that clinical time. Second year, we make some time to execute your research project. And there's kind of the breakdown. We have lots of evolution and change recently in our schedule, lots of really great updates. Wow.
And then third year, the year begins finishing up your research. And then the last 6 months is focused on kind of revisiting all of the rotations one last time before going out and being an attending on your own.
Yeah, I think based on a lot of the feedback that they'd gotten from the prior classes, everybody felt that, doing these rotations towards the end of your fellowship, they felt more equipped to kind of deal with these things as they became an attendee. Research at Brown. So now we've kind of, restructured our curriculum. You guys will meet Navneet Singh, who's one of the APDs for research, and it is going to be spread out into a 3-year curriculum. So the idea is that you find a research mentor, you plan a project, you come up with a feasible research question, and then you go through an NIH-style project creation. The idea is that at the end, you should have an abstract that you can submit to a national meeting, normally ATS, but they're pretty open if you want to go to CHEST, SCCM, or any of the other national societies. And interested fellows who actually want to pursue and look at research as a career are encouraged to apply for the T32 grant. And then, we do present a decent number of abstracts at ATS, CHEST, SCCM, circulation. So that's what the research curriculum looks like.
For our clinic time, we have an outpatient month experience, which is 2 blocks and then 2-week blocks, 4 2-week blocks in our first year. That adds up to be a lot of outpatient clinic time. And during that time, you also cover outpatient calls for patients that don't have appointments that day, as well as reading the PFTs and reviewing your reading with faculty to learn PFT reading skills. And we've added a new half-day clinic this year that is one-on-one with a fellow and attending to really hone your outpatient clinic practice. In addition, we have access to a continuity clinic once a week at our VA pulmonary clinic, and some new curriculum for outpatient clinical mentorship.
And this is just a breakdown of some of the options when you're outpatient going through these clinics. By no means is this everything that you have to do in a given week. But these are kind of the options, and it's a bit of a pick and choose. And then you can talk with Angel Marie or James as you design what you want during the week of electives.
We do have a lot of conferences that we do. So when you start as the first year, we do something called the boot camp, which is a summer lecture series that is normally done in the mornings for the first 2 months. New fellows will also do the airway simulation course that's done at our Chorus Sim Center, which kind of equips you to deal with, difficult airways. You can practice your intubations, a little bit of bronch skills. Mid-September, we are also signed up to do the ultrasound course at Tufts, which I think is really helpful because I know the 4 of us, Alexis is not here, but the 4 of us took a train ride, and it was really nice to go and kind of interact with other fellowships. Thursday is now not really an academic half day, but our teaching block. So what would happen on Thursdays is we would have our division grand rounds that we call chess conference. So we have chess grand rounds. 1 of the 4 weeks in a month, we will also have journal club. We have palm crit didactics, some ultrasound didactics that we are restructuring. We also have MICU M&Ms during this time. And then 2 to 3 is the time that's reserved for thoracic radiology. I think we all agree that that's one of the best things that we do here. We have 5 wonderful thoracic radiologists that we work with, and the first year fellows will normally read x-rays, CAT scans, and you will go over cases and really improve and hone your radiology skills. We also do a conference called the MICU, SICU, TICU Combined Grant Rounds, which happens every 2 weeks, where we kind of review cases between different ICUs and kind of learn a little bit from our surgical colleagues. And then once every 2 weeks on Fridays, we have something called the ILD conference, where you can bring forth your ILD cases for a multidisciplinary conference. We have a few ILD experts who are part of this conference, along with a rheumatologist, a pathologist, and then you kind of will go over cases at ILD conference.
Another great thing about being a fellow here is just living in Rhode Island and Providence, which is really fun. We're going to tell you a little about that.
So Providence, there's about 1 million people in the state of Rhode Island, and this hospital is the tertiary center for all those people. It's reasonably cost of living, especially if you're coming from Boston or New York. It's definitely cheaper from there. You have Brown here, RISD, URI, Johnson & Wales. You can get up to Boston either driving or taking the train. Also can take the train down to New York City or drive down there. And then there is a regional airport as well too that can get you around if you're not going to go up to Boston for the airport.
Because it's the ocean state, there are a lot of water activities for people who like surfing, people who like sailing. I think there's a lot of things to do here. This is the water fair, which seems to be the thing to do, although I haven't been to one yet.
It's really fun. It's really fun.
But I've heard about the food trucks there. And the polo, the derby is what I want to actually go to, because it seems like it is a fun thing to do. But as you can see, in the spring and summer, there's a lot of activities to do at Rhode Island.
It's also very beautiful in the fall, just as alluding to. At our zoo, we have this huge pumpkin festival, which is what this is a picture of, and they're all carved and beautiful. We have lots of apples and apple-themed events and farms. There's a ice skating rink, and you can pretty easily get to a ski mountain from here on your days off. They're the closest one's about an hour.
And then you can also get around, obviously, I guess these are all the different venues around. And it's, you can get to the regional hockey team as well too, as the Providence Bruins. And then, yeah.
They do have a small theater where I think they have Broadway tour every month, and there's like a new Broadway show for a week that runs every month. So I think that's pretty cool.
And quite a few community theaters. This is, I guess, just highlighting some of the best. I guess Providence is considered to be a top city overall by Travel and Leisure. I don't know what year that is. Oh, and then 2024 is a great town to visit, Providence.
And then I think a big thing for Providence actually is the restaurants here. It's not the biggest city, but you get actually really good food here. That's, I think, one of my bigger things. Yeah.
So good, yeah.
I agree. And then this is just a little bit of all of us at different community things that we've done over the years. We do try and hang out with attendings at least once a month, where we go to different areas and, sometimes we've done Top Golf. What else have we done? We've done bowling. Yeah. And then obviously as fellows, you guys will hang out. So our class is pretty good at hanging out and doing things. So we try to meet up every few weeks. I think we'll go to a new bar and then sample different drinks.
Our strongest asset is definitely our group.
Yes.
It really is.
All right. Well, welcome everyone. I hope you have a good day while interviewing around, and best of luck.
Right. Well, good luck.
We'll see you around.